It's been called a silent epidemic. Studies show rural residents experience higher rates of depression and suicide with less access to help.
Now a local hospital takes an innovative approach. Here to tell us more, Steve White joins us live tonight. And Steve, we think of how really resilient our small communities are, but can that actually be a drawback too?
Yeah, well, certainly many Nebraskans do feel plugged into their community, but there can also be a stigma to seek help in those communities. Now, Bryan Health working to change that with a unique approach in Central City.
You gonna figure out what's wrong with that?
Diagnosing a breakdown in the field during harvest.
If you need me to run parts, let me know.
A helping hand.
Okay, I love you.
But what happens when it's not the equipment, but the mind? Dr. Ryan Santon grew up on this family farm and now returns as a mental health provider at his hometown hospital, called a unicorn by the staff at Merrick Medical Center. The Bryan Health facility says it's one of the few rural clinics in the nation with this level of mental health care.
I think they may be on the cutting edge of this because it's been working very, very well.
Santon is an MD who became a psychiatrist, helping patients manage mental illness through medication.
Depression, bipolar disorder, trauma.
The other piece is
patients come to the same waiting room where they'd get their blood pressure checked.
We've embedded me in the rural health clinic so that we can help people's whole body, their brain, their mind, and their body in a kind of innovative and new way.
He gets it. I mean, his family, his dad's a farmer, his mom. He's just going to be able to connect in ways that maybe not other professionals at his level will be able to.
Mental health advocate Annette Dumas lives on a farm nearby where she reflects on how a friend describes the lifestyle.
She said, the thing I love most about my dad is his independence and, the way he can just handle things and make things happen. And the thing that frustrates me the most about my dad is his independence and thinking that he can handle everything.
Dr. Santon says at its best, that rural work ethic can lead people to do well with treatment. But too often it results in folks who suffer silently.
Farmers are at very high risk of depression, anxiety, lots of mental health concerns.
While other doctors save lives, Santon says his role,
give them back their life.
Now, he sees patients right along with the rest of the medical staff. That is intentional, administrators tell me, so that whatever kind of care a patient is seeing, they're not singling you out for seeing that mental health provider all there under one roof.
Steve White live in Grand Island. Thank you, Steve.